Well, hello. My name is Jodi Skulls, and I am your instructor for the MBLEx review course. We are all here studying to pass the massage and bodywork licensing exam. Yeah. And this course today, we are talking about the kinesiology of the knee. So we are talking about the structure and the function of the knee joint. Let me assure you, you're going to know more than you'll ever need to know about the knee. In fact, if you go on to take continuing education and it happens to be involved with pathologies of the knee or injuries of the knee or recovery of the knee, you are going to have a very strong foothold, very strong foundation on what we're studying. So, our class is in 3 parts. And those 3 parts are a test-taking strategy, learning, the actual content and learning, and the third part is dissecting questions. And our members in the Patreon community overwhelmingly uh, uh, gave us feedback that they love questions. So today we have a full 10 questions to dissect together. So we have a lot of work to do today, but it's going to be fun. We're together. We're studying. Let's get started with the test-taking strategy for today. And I love it that Alicia put in our comments that she has developed such strong study habits from being a member of this program. And that is my message for you today. Do meaningful homework. One of the main reasons maybe that you joined, but a lot of members join this community is because they don't know what to study. Maybe they bought a study guide or they've got their books from school or they've been using an app. And it's like, okay, but how do I know that I'm studying the right stuff? We have developed a very specific program for you of what to study. Every Monday, there is an announcement on the Patreon website, on your app, and that is what to study for this week. And we are bringing you through 12 sessions to prepare you to pass our practice exam. Yeah. And that's how we know you're ready to take the MBLEx. We know you're ready to take the MBLEx when you pass our practice exam, the MBLEx simulation exam, when you pass that 3 times with a 70% or better. And you've finished in under 2 hours. So this is the goal, ladies and gentlemen. The goal is to take that simulation exam and pass it in under 2 hours. And you pass with a 70 or better. And I want to see you do that at least 3 times. Yes. And then we'll deal with all the other stuff. But the learning part, as far as what to study, that tells us you've got a body of knowledge that is sufficient to take the MBLEx. Now, there's all sorts of other factors that play into test taking, right? There's anxiety, there's feeling overwhelmed. There's all sorts of things that energetically we also deal with. We give you the tools for, and that's other test taking strategies that I share with you throughout these 12 sessions. And so part of your preparation is to know what you're studying each week. Yeah, yeah. And that allows you to do meaningful homework so that you have a strategy. You know, okay, once I get through these 12 sessions, once I get through these 7 classes, once I pass this exam 3 times, boom. And then you can always direct message me and myself or Tara will answer. Am I ready? We can even do a 20-minute call, 1-to-1. Am I ready? If your friends are wondering, am I ready? Let's find out. Yeah. Part of what you're doing as you work through this course material is you are coming to class, you're watching these recordings. This is a part of meaningful homework, but also you've got a strategy for the rest of the week, right? So our strategy has you taking quizzes, has you taking practice exams. Yeah. And that strategy keeps you from, that strategy keeps you from feeling overwhelmed or keeps you from feeling lost. Yeah. All right. That is my test taking strategy for you today. Do meaningful homework. So I love it that you're coming to class. I love it that you're watching this, but this is only one brick in the wall that you are building. It is only one piece of the foundation. There's other factors that help to prepare you to confidently and calmly, at least partially calmly, pass the MBLEx. Let's move into our learning for today. Here we go. The structure and function of the knee. At times, I'm going to be hiding all the pictures here, and that is because I don't want it to interfere with what you can see. So the structure and function of the knee, I want to give a shout out to Scribe, SCRBD. That is a slide share site that gave me some of my images for today. And it specifically was Dr. Zinat. I used a bunch of his images today, so thanks for that. All right. Let's take a look at what the knee actually is. The knee consists of the tibiofemoral joint and the patellofemoral joint. So technically, the tibia and the femur come together. We always call it the knee, right? However, the scientific name is the tibiofemoral joint. And from a medical point of view, the patellofemoral joint is also considered anatomically a part of the knee. So the kneecap, the patellofemoral joint, so the patella is sitting on top of that femur. We could compare that to the scapulothoracic joint, right? Where there's not really an articulation there. It's actually just the shoulder blade that glides against the rib cage. Likewise, the patellofemoral joint isn't a traditional joint. It's the kneecap gliding over the head of the femur. All right. Let's take a peek. Here's the femur. Here is the tibia. And here is the kneecap. So this is considered the knee, the tibiofemoral joint, and then the patellofemoral joint. And you can see how this patella is actually gliding over the femur, right? Let's briefly talk about what type of joint the knee is. The knee is a synovial joint. Synovial joints are what we think of as joints. When you and I talk about joints, it's what we think of as joints. These joints are considered diarthrosis, so they're freely movable. The other types of joints in our body are not as movable. They're either semi-movable or they're considered immovable. So examples of those would be our pubic symphysis would be semi-movable. The sutures in our skull would be considered immovable. So diarthrosis means they move. And synovial are the 6 joints that we think of when we think of our joints. All right. I liked this picture of the knee joint because you could see a bunch of the different structural characteristics of the joint. And this is, so you've got a joint cavity, and that really is what determines a synovial joint, that there's a joint cavity. And it contains synovial fluid, therefore its name, synovial joint. This joint cavity is cushioned with that synovial fluid, which is secreted by a synovial membrane. I wanted to introduce you to cartilage. This is called articular cartilage because it articulates, and articulates just means touches or talks to. So this is articulating cartilage, and this is the knee again. So this is the femur and the tibia. Yeah. So I liked this picture as far as the structure of the knee joint. We'll get a lot more pictures of structure of the knee joint. Yep. Good. Nice big picture of that. Again, there's the distal end of the femur with the articulating cartilage. That white stuff is the cartilage. And then the blue stuff is the synovial fluid filling that joint capsule, produced by the synovial membrane. That's this little outside part here. Good. Another angle, I didn't think this was quite as clear, but it is an actual x-ray of a bone, of a knee. So you can see the femur, the distal end of the femur. Here's that patellofemoral joint. We've got the tibia here. You can see the tibia is larger in its proximity in this image. And then we got the fibula hanging out over here. So we're kind of looking at kind of a back picture of the knee joint. So here's the proximal end of the tibia, the proximal tibiofibular joint. Yeah, nice little anatomical structure here. Kinesiology of the knee joint. Little review. The knee joint is a hinge joint. The two movements of that hinge joint are flexion and extension. The tibiofemoral joint is the name of the knee. Quadriceps extend the knee. Hamstrings flex the knee. And the muscles, tendons, ligaments, those all lend joint stability to the knee. All right. Are you ready to test your knowledge? Yay! It is time to dissect some questions. I will remind you to please be careful. There are intentionally tricky questions here. Take your time. Also, for the purposes of letting everyone have a chance to answer, if you would please put your answer in the chat box. But if you would wait until I say 3, 2, 1, go, before you send or share your answer. All right, let's see here. We got a couple questions coming in. All right. Ready? The tibiofemoral joint is a blank joint, and its actions are blank and blank. The tibiofemoral joint is a blank joint, and its actions are what and what? A, hinge joint, abduction and adduction. B, a hinge joint, flexion and extension. C, a ball and socket joint, abduction and adduction. D, a ball and socket joint, flexion and extension. A test-taking strategy is to eliminate at least one wrong answer. We'll be doing that today. So what do you know you could get rid of? Is there something that just jumps out at you with this question that says that's not right? Let's go ahead and get rid of letter C. Because the knee joint, yeah, that's not the tibiofemoral joint. Yeah, doesn't do these things. So get ready with your answers. The tibiofemoral joint is a blank joint, and its actions are blank and blank. Would that be A, a hinge joint, A, abduction and adduction. B, a hinge joint, flexion and extension. D, a ball and socket joint, flexion and extension. 3, 2, 1, go. Let's take a look at what our answers are. Good. Yes, Lek. Yes, Emily. Yes, Lily. Good, Dora. Martha. Excellent. Patithia. Yes, Diane. Miss V. Good. Ooh, ooh. Let's come on back. Let's come on back. Martha. Yes. Patithia. Yes. Diane. Yes. Kesha. Yes. Brienne. You got it. Amy. Alicia. Good. Maria. Good. Letitia. Yes. June. Yes. Excellent. The tibiofemoral joint is a hinge joint, and its actions are flexion and extension. Yes, careful. Tibiofemoral joint is another name for the knee joint. You saw femoral, you might have thought hip. All right. The fluid contained in freely movable joints is called what? The fluid in freely movable joints is called what? A, bursa. B, fat pad. C, synovial. D, cartilage. The fluid contained in freely movable joints is called what? Let's get rid of one wrong answer. Fluid is not, cartilage is not fluid, right? Right. Cartilage is not fluid. The fluid contained in freely movable joints is called what? 3, 2, 1, go. Let's see. Camelta, yes. Alicia, good. Brianna, Yep. Yay. Martha, yes. Emily, good. Latil, yep. Tisha, yep. Petithia, yes. Diane, yes. Lily, yes. Ms. V got it. Lek, yep. Dora, good. Kasha, yep. Amy, you nailed it. Kersha, you got it. Raina, got it. Good. Best answer, the fluid contained in freely movable joints is called synovial fluid. Yes, synovial fluid. The sartorius muscle is responsible mostly for movement at the hip. Its attachment point, however, is blank. Is where? The sartorius muscle is responsible mostly for movements at the hip. Its attachment point, however, is where? A, medial knee. B, lateral knee. C, anterior knee. D, posterior knee. Sartorius muscle, mostly responsible for movements at the hip. Its attachment point, however, is where? Let's get rid of one wrong answer. It's not the posterior knee. It is not. Okay, the sartorius muscle is responsible mostly for movements at the hip, but its attachment point, however, is A, medial knee, B, lateral knee, C, anterior knee. 3, 2, 1, go. Martha, yes. Alicia, yes. Dora, yeah, Diane, good. Good. Ms. V, yep. Lily. Emily, yep. Kesha, yep. Latil, yes. Brienne, got it. Kersha nailed it. Amy's on top of it. Yep, Marina, yep. Maria, good. Very good. Best answer, sartorius muscle attachment point is at the medial knee. Yes, medial knee. Remember, it's that S muscle. Starts at ASIS, comes across, and touches the medial knee. And really, if I was being technical, I should have said tibia. Medial tibia, lateral tibia, anterior tibia, or posterior tibia. On the MBLEx, you're going to see it as medial tibia, lateral fibula, anterior tibia, posterior femur. I was kind on this one. Sartorius, origin, ASIS. Insertion, remember, the PES answer, tibia. Medial knee, medial tibia. All right, so that's it. Got an hour and 15-minute class, but you got a great sample. So my name again is Jodi Scholes. I'm your instructor for the MBLEx review course. Hope you enjoyed the class. If you like this style of learning, consider becoming a member or purchasing the class. You can do that. I'll give you the directions down there in the description, but look forward to welcoming you as a member or to hearing your feedback in the comments. Have a great rest of your week. Have a great day, and we'll catch up again real soon.